today. I'm Jan. This is Daniel Reimer. He's helping us with some data. Corey Redden, who is the guru of all disaster planning. And Mariana Casal, our epidemiologist, will be joining us in a few minutes. So I think we'd like to start with Corey. She wanted to give you some more information about what's happening with the mask distribution.
Good morning. So Health and Human Services is rolling out the mask deliveries to all the states, and currently they have pushed out adult-sized masks, and they will be pushing out youth-sized masks. The state is expected to receive a little over 3 million in masks, and those are getting distributed to each county public health department, and then from there it gets pushed out. We are looking to deliver those once all of the masks come in. So we have, some that have come in, but they're only adult sizes. We're waiting for the child sizes, and we're looking at how that allocation will be per school district. This is for the low-income populations. And so because that's hard to determine, it looks like the state will get an adequate amount to cover all the school districts and anybody who needs a mask. And then too, there's some schools that are completely virtual learning for certain students or certain groups. So they may not need a mask, but it's for in-person instruction. But we understand too that if you are going to go into in-person instruction, we want the enrollment data just to cover all that and make sure we have an adequate amount for each school district. So I know Jan sent out a survey to get that enrollment data from all of you. And if you haven't filled that out yet, or you're still working on it, there is time, because we aren't expected to get the youth size masks until another week or so. They haven't alerted us this week that they have any deliveries or expect any receipt of any masks from HHS this week, but we'll keep everybody posted. And then we'll work out the numbers on the school districts, and then the school districts can allocate to all of the schools in their district. And we'll have a printout, and we'll have the numbers that would go to each school for both adult and child. There are some schools that they aren't listing adult sizes or listing for staff, and that's fine too. If we do have enough, we may just automatically push out some so that you have some for staff that need a replacement. So that's the situation there. And like we said, once we get all the masks in, we'll alert everybody and work on the allocation. But you do have time to get your survey done, and if you have any questions, Jan's been taking care of those inquiries as they come in. So I think that's it. Jan, did you have anything else on the survey or allocation?
No, I think we're good. I appreciate all of you who've already chimed in and sent us in your numbers and things like that. I think we're going to pull up some numbers for you now.
I'm not presenting yet, but let me get the drive up first.
Well, I can give numbers meanwhile.
Okay.
Good morning. I apologize, I was late, but I was in another meeting. So far year to date, we have we usually give you the data up to last week, but this time we're gonna do something different, and I'm gonna give you numbers up to yesterday. And it's only because I want to show a part of graphs, a couple of graphs that we have in this new graph report. So this is what we use for September for our ICC, and this is for yesterday. What happened during the weekend, and I know that this looks really weird. We said that it's between a praying mantis and the Pikachu pig or something like that. So the most important thing here, this is actually what we have seen reported in yellow, in orange. This is the number of cases that have been reported per week, and these are the number of cases that have been confirmed. So we have had, from the beginning of this, that was March 9, we have had 15,561 cases reported, possible cases, and we have confirmed 10,615. Now, there are some things that you see here, like usually what we expect is that people are testing and some percentage of those testing are positive, okay? So when you see the percentage of positivity, that means how close these curves are. Now here, this is the beginning, we began in week 9, and this artifact on data that is here, it's when we begin, if you remember, we needed to test everybody through CDC, but then the commercial labs came in with the possibility to test, and the order was anybody that wants to be tested can go and be tested. So this is what happened here. A lot of cases reported, a lot of people went to be tested, but not too many were actually positive. And then we have this second thing, and this is between the end of April, week 15, and then maybe you remember also, the governor did these 5 weekends of testing blitz. So we're going to test everybody that we want or would like to be tested. So they tested a lot of people that didn't have the disease. So they were reported as a case, but came back as not a case. And we get kind of stable in the transmission until we hit Memorial Day. And this is around Memorial Day. And you remember the first week after Memorial Day, the cases begin increasing, but the second week we have the first spike. And it's because Memorial Day was Saturday, Sunday, and Monday, and we know that we begin seeing cases of COVID after 5 to 7 days, so that gives reporting on the second week. And from that, we keep going up and up and up and up. And then we went down. This is the correctional facilities testing. And we were going down after that, but this week, beginning Sunday, we already have an increase again in reporting and confirmed cases. And this, for now, is just beginning transmission on community again. Up to yesterday, we have 0 cases reported from correctional facilities. Last week, 0 cases reported for correctional facilities this week. That can change, of course, because we still have time in the week. But this is what we see every day. Now, this is very low, yes, but it's only counting 1 day of the week, and it's Sunday, because this was what we did on Monday. So at the end of the week, we don't know where these dots could be here, could be here, could be there. That's what we're waiting for. But even though the numbers are lower than a pandemic, we are seeing more activity in the community, and we really want to be to everybody to be aware of that. So don't relax your measures, please. Don't relax the mask. We're still on it. So these are the cases that we see per week. What you see in the blue bar is the number of cases. What you see in the blue line is the average cases per week. That's why some are up and some are down. This is the curve that actually mimics the curve that CDC showed us what we should expect on a pandemic. And it was actually this. It's like up and down and go. So beside this part where you see this yellow, this, again, orange columns, these were the testing in correctional facilities that make that artifact. If not, this would have been like this. And now we're looking where we're going to go from here. Our expectation is hopefully go down and keep going here. But remember that we just begin week 40, the flu season, and this could begin going up again and give us a second wave if it goes coincidental with the flu season. Now the numbers here you see here, these are confirmed by PCR positive. It's 10,470 cases in the community, and correctionals in Pinal County. The probables are 145 so far. These are antigen positives and EpiLink cases, and the suspected are serology for 199. Serology is not considered since a couple of weeks ago. We changed the definition of how we're going to consider that, what we're going to consider a diagnosis test, and serology is not good for diagnosis or anything because it doesn't give us too much information. It's not super specific. It can have cross reaction, and it takes kind of too long, so we cannot even relate it with the event that make you do the antibodies. So now there will be classified as suspected, and we will not call anybody or do any investigation. We need PCR or antigen to do a good classification. So these are the deaths that we have in the county, and this is the difference between correctional facilities and community. You see here, week 39, 0% cases, week 40, 0% cases, and from all the cases, only 16% are year-to-date inmates or detainees that are not moving the community. Now we brought up these graphs today because I want to show you this. So the influenza season goes from week 40 to week 39 of next year. So the influenza season will never be named per year, like COVID will be named per year. We're gonna say year-to-date 2020 COVID cases. But the influenza season, you will always see it with two numbers, with 2 years, like the school years. So in the season 2018-2019, Pinal County has 1,197 cases confirmed of influenza. And in the season 2019-2020, that was past season, we have 2,342 cases here. So what you see here, the blue dots are the previous season, and the orange is the past season. What we normally see in Pinal County is that the cases begin getting up from week 44, 46, and week 50 is before Christmas. So this is after Thanksgiving. And this is kind of the 48 is kind of Thanksgiving. After Thanksgiving, flu always begins to go up. Last year we have this peak, and then we went kind of stable and sharply went down. In week 9 was when we began COVID. So we sharply going down, and we have this increase that was not regular for us, because if you remember, when you have the suspicious of COVID at the beginning, we needed to test everybody for flu. If you were flu negative, then they're going to give you authorization to test for COVID. And this was the rule from CDC, not ours. So that's why we see this spike that we usually begin seeing going down. But then nobody else tests positive for flu. For more than they were tested, everybody was negative, and it was only here was when COVID was going up. So, and we didn't have more cases. That, like, the flu season was really cut by COVID. And this not having any case here, it's mainly because of the measures of having the mask, of washing your hands, of being socially distancing, because it's also respiratory. And it's very interesting that, and hopefully that's the case that we're gonna see, that we don't see too many cases. So in the season last year, again, you have here the old, the previous season, 2018-2019, and we have actually a huge activity of, a big activity of flu, beginning with the flu B. And that was a big thing from last year, having this outbreak of flu B that was mainly Victoria, like 20 or 30% of these cases were B Victoria. And it's very interesting on having this, because it was like 10 years that we didn't have actually a spike on flu B. And the flu B, the coverage for the vaccine is like 32% to 45%. So there was development, sorry, there was development of flu B and cases that we were seeing. But then these changed, they began to go down, and you see how the yellow, the flu A came up, and it was flu A unspecific. We expecting more H1N1, but it was unspecific for us. What is really also interesting, because the previous years has been A1, H1N1. So we don't know what is going to happen. This is what happened last year. So we have this dual pandemic, and with cases beginning early in the season, and with the peak in between February and March, that is give us a complete different curve. So we're preparing for something that the newspaper are calling twindemic, because we're going to enter in a very important period where we can have flu and COVID at the same time. And when we do surveillance for flu, I want to refer really shortly about the RSV. The RSV is the respiratory syncytial virus, and this virus is very important in toddlers and elementary school kids up to 8 years old, but mainly around 1 to 5. And this is a very bad virus for them, because they have their lungs in development and affects a lot the ventilation, and also the amount of mucus they need, respiratory therapy, they need a lot of things to help them. It's highly associated with hospitalization or big clinically being very bad. And here you have season, the green one is 1920, and we also have a spike early on this season. And the 2018-2019 was late. Usually what we see is this began at the beginning of the year, like after Christmas. After Christmas is, so the normal here is 2018-2019, what you see in orange. That when you see the spike of cases and goes up to March. In March, like when it's not like super flu, you begin testing the kids for RSV, and then they go down. But last year, as flu, we saw it earlier, and the peak was higher and earlier, and then went down just like flu because COVID showed up. So actually, we will be doing surveillance for 3 viruses and more, because usually we ask for a respiratory panel that has 7 other respiratory viruses. So this is the panorama from now to at least March, is the time that these 3 viruses will be active. At least flu and RSV are active and having their peak. So this is what we're preparing for, and we really need your help in the surveillance and reporting. So I'm going to leave you with the flu.
Well, it's a shame they don't keep you busy, Mariana. My goodness.
Yeah.
What a nightmare. So we are not looking forward to the holiday season like some people might. Please do me a favor if you would type your questions into the chat box. I did want to kind of talk about a few definitions that I got from the Arizona Department of Health Services. As you all know, I've been kind of liaising with them and trying to get some answers for you. So I know that trigger definitions have been on your list for a while now. You kind of wanted to know when to go, you know, from in-person or hybrid back to to virtual instruction and all of those kinds of things. So I will just read them to you if you don't mind. ADHS recommends that local education authorities consider a return to virtual instruction when one or more of the benchmarks are in the substantial category for 2 weeks in a row. This may or may not be the same benchmark. So when you're looking at the benchmarks every week, you know the substantial category is the red category, so that's the one we're looking for. When a jurisdiction meets the benchmarks for minimal community spread, LEAs can elect to resume traditional in-person instruction, which may mean they no longer provide virtual instruction. As long as there is very minimal community spread of COVID-19, policies for masking and physical distancing should be in place, then you can return to the in-person instruction. ADHS is going to update the table that explains this in the returning safely to in-person instruction guidance that you have on the ADHS website, because really when it was developed to talk about what's happening now, and they didn't foresee the point at which we may be back to regular in-person class. And ADHS recommends that schools consider traditional in-person instruction when the benchmarks meet criteria for minimal community spread for at least 2 weeks in a row. So just like everything else, you want to have that 2-week buffer point, right? Questions about that? You can unmute or put them in the chat box. Okay. There has been some questions about holidays, and I know that there's one just down the street from us, so I know that the kids are all looking forward to Halloween, and I've seen somebody's making a mint on the masks that have like the Halloween masks, so somebody's figured out how to do that. Currently, by executive order, any congregation is limited to 50 or less. That is Executive Order 2020-43. This is still active and there are no exceptions for schools. Cities, towns, or counties can grant approval for sizes greater than 50, but they would need appropriate mitigation strategies. So schools should consider messaging before the holidays about congregations and things like that. So I know that a lot of schools usually host like Halloween events and things like that. So this may be the year that you consider drive-through, trunk or treats, those kinds of things where you wouldn't have 50 people in the same place at the same time, and there would be socially distanced and all of those kinds of things. Or just let it go with the classroom, party or whatever it is. You don't necessarily have to do anything for for this holiday, but just keep in mind that limit of 50 is still in place until we hear otherwise. Questions about that?
Maybe some people has been seeing the Halloween guidelines from other counties. We still don't have one completely. Some measures can be seen like very extreme, like there are some recommendations of not everybody has their hand in the same bowl of candy. And we're considering everything, but we also would like to say that if the candy, for example, is wrapped and you wait a day, whatever is in the wrapping paper will die. So if you want to get kids trick or treat with gloves, maybe things like that, or the most important thing will be that if you do a trunk or treat, for example, do not have the big things, or have just one person with a spoon, with a scoop, trying to give them something in their bags, or do individual bags and hang them so they will bring them. So they are, I don't need to tell you, the teachers are much more inventive than me. I don't have too much imagination, but it's not that we're not wanting to discourage it, but we want it safe.
Yeah.
And that's kind of the most important part for us. And especially because too many of you are going to begin instruction in person, and then when we do the investigations, these kids that were together in the school, then they organize themselves to go outside trick-or-treating, and then they bring everything back to the school. Even though the transmission was not at school, was actually when they were trick-or-treating or they would have a party in their house. So we discovered that in our investigations.
And you've been doing quite a few investigations around schools lately, so thank you for all your hard
I'm
work.
waiting for the benchmarks to talk about those two,
Okay.
the investigation.
And then the last piece I hope you'll weigh in on, and that was COVID-like illness. The statement that I got from ADHS was that they want to put out additional guidance for kids with alternative diagnoses. So like if a student or a staff member has symptoms but doesn't get a test, then of course they have to isolate for 10 days. But if that student or staff member has symptoms, gets an alternative diagnosis, then the recommendation ADHS is making is that you would isolate per the school sick policy. So they're going to put out additional diagnosis criteria for that on the ADHS website, so that you as a school might be able to figure out what's appropriate. Like like should we be asking for a doctor's note, those kinds of things. So be looking for that on the ADHS website.
Usually when the kids have some chronic things like asthma, for example, the parents know exactly when this is actually an asthma attack, and if it was for exercise, for allergies, or if you don't know what it was for, maybe you need to go to the doctor. All those things are going to be kind of supposedly outlined in ADHS website. Yeah.
Okay. So did you want to review the benchmarks?
Yeah, we do have the benchmarks. So Daniel can give you that. I didn't.
They were in an email
They were in an email.
Okay.
that Daniel sent you.
Yeah.
There you go.
Let me.
We're pulling up the benchmarks. You should have all received them via the School Health Advisory Network email that I sent you.
Sorry, but I didn't have time to do.
924, right?
Yes.
There we are.
Okay, great. Let me present.
Thank you.
Right. There we go. All right.
Okay, so the trend has continued, getting more and more green as we progress, to the point where there are only a few districts left that aren't entirely green across the board. And those districts, I imagine, in the coming weeks will be green as well, barring when the second spike comes. And so I'll be working on the next week here in a couple days, and I would expect it to be fairly similar to this week, just maybe a little bit more green.
Good. So that's where we are with the benchmarks. Everybody's doing such a great job with their mitigation plans, and I do appreciate all your hard work. I know it's not easy to try and to navigate this whole situation. It's not easy for us, and we're in the business, so there you go.
Also remember that this is by zip code, and most of the time we need to consider what the closer zip code, or if you have one zip code and a half, we need to kind of we're giving you our best estimate on how your whole school district will be evaluated. Now, there are areas, and as Jan said, the schools are doing a good job, but sometimes the community do not, because they don't have kids in school, they don't care or whatever. So it could begin turning in yellow again or in red if we have more concentrated cases increasing in the community. So for more that we love to give you green, we still will be try to be very fair and giving you a good estimate, because you need to know if you're back to yellow. And also what we would like to review now is, for example, to let you know that we have already 2 outbreaks open in schools, and these are schools that are in hybrid or is still virtual, but the kids are doing extra activities. It's mainly sports. Both are connected with sports teams, and it's very important to remember that when we ask for quarantine, it's not to bother you, not to leave the kids out in their house without doing sports or without competing for sports. But if the team is in quarantine, they cannot go to a game with somebody else from other districts. That's very important to know. Quarantine is quarantine. You're not having games, and the problem is because then the second member of the team comes sick, and then we need to extend the quarantine. Then if the third member comes sick, we need to extend the quarantine, and you're going to lose the whole sport season. So we need to be very, very careful about it. Both were detected by the local health department, and we are working on waiting at least for 2. We need 2 incubation periods without any new case related with these previous cases or situation, and 2 incubation periods is a month, 28 days. So that's why it's so important that everybody actually takes care of themselves, and the sport teams do what they need to do and don't do what they don't need to do. Don't go to a game if you are in quarantine, please. And also, most of the cases, most of the outbreaks, we're seeing that we're going to see people that we will need to join with Maricopa County because we have a teacher that lives there or is in the border. So we will have those things, and you could be receiving, people would be receiving information from both counties. So if you receive any information from Maricopa County, we should know, but ask us anyways, because if that takes your attention, maybe we haven't received the information yet. Now, so far, we have received a lot of reports, and we really appreciate that because we receive the reports, we have somebody that will do the investigation, trying to do it at the same day or even the next one, and we have been able to connect these 2 outbreaks because of that, because of receiving information from the schools. So thank you so much.
I also wanted to mention that all of our clinics now have the flu shots, so you do want to call in advance before you come in.
Yay! Today. It was today.
So we're calling in advance before you come in because obviously we want to social distance and we want to make sure that there's not too many people in the waiting room at any given time. But the children's flu shots are available as well, and in public health, all of the childhood immunizations are no cost. So there should be no reason that kids couldn't get their flu shots if their parents wanted to get them.
Yeah, and the clinics are trying to organize flu clinics even on a Saturday with the help of some public health nurses. So if you can't go during the week, you can at least maybe go on a Saturday. It's going to be advertised in the website.
And then Jen, you can send that out via Sean.
Yep, I'll be happy to send that information. But in the meantime, you're welcome to just hit our webpage, which is pinal.gov/public health, and all of that information. And of course, the testing information that we've discussed before for COVID is on the website as well. So everything's in one place for you. I do not see any questions in the chat box, so I'll give it a minute. But if we've been that efficient and nobody has any questions, that would be a great day.
Mr. Randall!
Yes, we will be sending the recording out as always.
Yeah.
Oh, I'm so glad.
Awesome.
Yes.
Thank you.
I guess the question that I was going to ask was, and that would be of the group entirely, is if you feel that it's still necessary to have this every week, or should we kind of do this like every other week?
We're doing it.
Are we doing it every other week? Okay. So not next Tuesday, but the following Tuesday, I will send you an invitation for that.
Oh, thank you, Charity.
Thank you so much.
Oh, that's good. Thank you.
Awesome.
Well, if that is the case and we have no questions, I would love to give you a few minutes of your life back.
Yay.
Enjoy your morning. Thank you so much. And you know how to contact me if you have any questions. Bye-bye.
Goodbye.